it is my pleasure to introduce our next speaker, Jairo Villafara. Today he will be discussing geographic distribution of motor vehicle collisions involving pedestrians. Please join me in welcoming Jairo to the stage.
Thank you. Very kind. Thank you for coming. This is what happens. I have here some handouts, and I really need you to share them, or at least for a couple of minutes, see some of the tables that are part of the presentation, so then you know the numbers behind. That will be fine. Thank you. Basically, what I want to do is the following. I just want to bring to your attention the need for us to incorporate equity in the analysis of collisions involving pedestrians. I'm asking you to please focus your attention on the roadway characteristics, on the scale of the problem, and also on the level of intersections that we want to discuss today. So, thank you. This analysis is part of a series of analyses that I've been conducting, advancing in Winnipeg, and the purpose of those being basically to advocate for pedestrian safety in the city. The first analysis entails the analysis up to the year 2019, and then there was, during the COVID time, kind of an interim report requested by the City Hall. The idea here is to provide more insights to all those ones involved in the issue of pedestrian safety in the city, and also to advance some of the recommendations that have been included in this report. This is crazy. So, I need to check. One of the purposes of this is to increase our community and policymakers and users' understanding of the various factors involved in the analysis of these pedestrian collisions. Identified historical and potential problem areas for pedestrians by accounting for location, the characteristics, by analyzing pedestrians and driving behavior, and vehicle characteristics and environmental factors related to the collision. And we want to finally identify some deficiencies that are existing in the network system that basically pose as barriers to the mobility of the pedestrians. The City of Winnipeg has a number of documents, plans, legislation, regulations, guidelines. Those ones, one way or another, entail the need for advancing pedestrian safety. So it's with this in mind that these observations come into place. But unfortunately, despite the fact that they have this planning framework in place, the number of fatalities involving pedestrians in the city is still increasing. The point here is that as pedestrian fatalities increase, pedestrian safety deteriorates, and therefore mobility at the neighborhood level becomes compromised. And also, the number of pedestrian fatalities is a good indicator for us to find out how safe is a neighborhood for us to walk. So these are the elements that are the basis for this kind of analysis. There are two sources of data based on this analysis. That's the reason I'm asking you to please have a look at some of the tables. That information, the first one, is coming from a report produced by the Public Works Department in the City of Winnipeg every year. It's called the Annual Collision Report. So what I've done is to review from the year 2012 to the year 2020 the different kind of tables that only deal with pedestrian issues, and then basically put together those tables that you see in your handout. I collected the information from the reports, put it there, did the analysis, and following the methodologies suggested by the Federal Highway Administration, I use or employ the 5 years rolling average in order for us to be able to facilitate the understanding of this data. That's the number one. The second point is Manitoba Public Insurance. For you, it's important to understand, in Manitoba, the insurance company, the motor vehicle insurance company, is publicly owned, is owned by the province. And therefore, that's where this information is coming from. There is a situation there. We have a no-fault insurance policy. So people don't quarrel when there is an accident. They just give away a number of license or something, and then the whole thing is done. But then we will see exactly, I don't really know, but we will see some effects of this particular kind of friendly reporting of traffic accidents. So, what we want is to also understand some of the factors involved when we do the analysis. Number one, when a pedestrian is seeking access and mobility, they also seek for routes that are very well designed, but provide continuity and safety. So as pedestrians, we don't want to be going around. We just want to go straight in a very safe and secure manner. However, it has been observed in many jurisdictions that people cannot safely cross the streets. On their journey, pedestrians, they have to interact with something called intersections. And those intersections are really the meeting place for so many movements at the same time. Vehicles, pedestrians, bicyclists, everything happens to be there, and people are moving in different directions. That's the reason for us to place some kind of controls and to regulate these interactions at the intersection level. But the point here is that intersection, generally speaking, but this is not an engineering conversation, but generally speaking, that's my understanding, they are designed for the largest vehicle and then for the largest turning radius. Sometimes that's fine for a vehicle, but sometimes it's not that good for a pedestrian. And because pedestrians, they have different kind of abilities. They have age, they are very little, sometimes they have disabilities, and they have mobility problems. So these are the issues that when we are designing or engineers are designing an intersection, probably they may be overlooked because we want the fire truck to go around or the big truck. So. But in addition to this, we need to also be mindful of the fact that we have a built environment. If you recall in your mind, whenever you are going to the big shopping mall, what happens? Have you ever walked to a shopping mall? Why not? You want shopping, why don't you walk? It's very difficult because that hierarchy of that road that goes into these particular kind of activities forbids you, prevents you as pedestrian for actually having access to that thing. Mostly you need to use your vehicle in order to get there. So these are the elements, but one element that we've been paying attention really is the issue with arterial roads. Because there are way so many, they have way so many lanes, they have particular functions, and they sometimes interact with different land uses that really are completely negative for the pedestrian activity surrounding them. And sometimes some of these arterials prevent the person from actually walking safely, crossing, because in some of these ones we have a lane dedicated only just for parking. So then basically adds another extra friction level to the pedestrians crossing when they are doing it. So we know now what happens to the arterial. So now we have the methodology. I explain rather quickly what's happening with this one, the methodology that we use. But what I want to do is to let you know that part of the analysis includes the analysis of the number of collisions, the number of victims by injury, by the type, according to the mode of travel, the severity by road location, of all injuries, the age, the pedestrian action, and the driver's maneuver. These are the elements that are consigned in those tables that you have right there. So I want to go over from table number 1, for the ones that have the outline, the handout, to number 8, rather quickly, so then we understand what's happening. So when it comes to the number of reported collisions for the entire city, and we do the analysis, there is a steady increase in the total number of reported collisions. So that means they've been, from the year 2012 to the year 2020, they've been on the increase. And I said steadily. That means that is something that very fine, but we can see it. So over there you can see some of those intersections are really one of the hot spots where we have some of them more dangerous for the pedestrians. So when we talk about the number of registered vehicles in the city, that is over 700,000, you may have the number right there in your table. We notice there is an increase in the total number of reported collisions. Basically, the number of vehicles, as they start growing up, is exactly the number of collisions is happening. So there is an increase in the number of reported collisions causing property damage, but there is a relatively consistent number of fatalities, which average 12.5. That means 13% per year. That means whenever somebody dies, basically of all the accidents that we have in the city, 13% of these ones happens to involve a pedestrian. So here we have the total number of victims by injury type, the collisions by injury type. So we have a steady increase on all the categories: fatal, major injuries, minimal injuries, minor injuries. So that means that those collisions are really, for the pedestrian point of view, actually dangerous. So either the person may die, either the person may be maimed or has to be taken to the hospital and then given some days for something. There is a minimum injury, probably a neck or something. So all of these ones, whenever there is a collision involving a pedestrian, there is an injury type. There is a problem because most of the time we said, or the engineer said to us, that the most important or most dangerous point for a pedestrian is the intersection. That's where most accident happens. Well, there is a problem too, because the highway administration also says that actually they happens to be in the middle of the block. So in order to test those two theories, I basically did a table, which is the table 3B on your handout, and the results are rather compelling because what we found out is that at the intersection level, we compare accidents based on the intersection and accidents that took place away from the intersection. The results tell us that basically most property damages at the intersection, non-intersection more property damages, and at the non-intersection, accident causing a type of injury. The problem here is that most of the reporting is done in one single mode of travel, basically in one single database. We put all the modes into one it's impossible for us to distinguish who is the pedestrian, who is a bicyclist, who is a driver. And that is also clouding the analysis. So very important for us to do that. I have to, this is not a, how do you call it when somebody tells you the movie? A spoiler. Yeah. This is not a spoiler alert, but I have to give it to you. That table, I also did it because there is a problem. In your handouts, there is a very minimum correlation between the locations and the type of accidents. But there is another problem in Manitoba, is that people sometimes don't recall where the accident happens. So you don't need, sometimes people say, at the corner of this and this and that. But in reality, we probably give that kind of coordinates or location in order just to get rid of the problem. But in reality, it's possible that the accident actually happens in the middle of the block. And because we don't have the coordinates for the middle of the block, we ended up by adding accidents to corners or intersections where we don't really know if it is proper or not. And because of that, then that is very difficult, has been very difficult for us to find out whether accidents actually, which one is the most dangerous, the non-intersection or the intersection. That's part of the problem. So in some cases, the pedestrian may be hit at the middle of the block. The pedestrian may be hit on the sidewalk, which is the case in some cases, or on the shoulder of the road. So, but we don't know how to locate that. So let's see what happens based on the age of the pedestrian. So we have the largest group is the 20 to 20 years old, and these are the ones where we have the highest number of deaths pedestrians, and we have the number of non-fatal injuries. And in part, this may be explained because these are the fellows that are students sometimes, are going to work sometimes, are riding bikes or doing other things around, or this is where it's happening. So they are more active, socially speaking. So that's the number of pedestrians. The number of pedestrians by pedestrian action, by all modes, by all injuries. So from the year 2012 to 2020, about 42% of reported fatal and severe injuries combined happens at the intersection when the pedestrian had the right of way. That's very telling. So something happens there. How this could happen? I have the right of way. So I leave this to the engineers to discuss the issues with timing, to discuss the issues of whether those pedestrian push buttons are really working or not, to design or redesign some medians, because that's exactly what happens. Many of these accidents happen in arterial roads without medians. So then the person has to sometimes stand on the line in the middle of the road, waiting for the cars to pass by her. So it's a very perilous situation. So, but the point here is that about 34% of those pedestrian actions, that means the action is crossing the road with the right of way. There are 13 actions. 34% of those actions were reported as unknown. If we ask them, what were you doing? They may say, I don't know. They don't know that they were crossing the road with the right of way or without the right of way, or when the signal was working one way or the other. So that's where the problem really is. As you can see on one of those slides, sometimes for the pedestrians it's very difficult to cross 8 lanes. See, that's the perspective that you have over there. And there is a lady crossing with a little baby is in one of those, you will see it later. So when the pedestrian was crossing, he or she was with the right of way, but then we have about 30% of all people involved in fatalities are between the ages of 15 to 29. Again, the young ones on the streets. But again, when we ask them in this category, what happens here with the actions, there is an incomplete traffic report. So this, before, remember we said 34% of those actions, and now this is even more telling. Now we don't know, it's 40%. So with this, it's very difficult for us to set up a policy, because it's almost half of the accidents that we don't really know the proper location, we don't know the proper coordinates, and we don't know what the driver was doing, maneuver, or the action for the pedestrian. So I have that little table right there, and you can see on the top, that's the 24% of those going straight ahead. See, but here I don't have. What I want you is to pay attention to here. See, we have 187 crossing, and guess what happens? This is almost twice that people don't know. So we cannot really affect any policy by having that kind of information. So then now we have the number of motorized vehicles colliding with the pedestrian by the action by the driver. What was the driver doing? He was straight away, basically, or she or he. One problem that happens is sometimes we tend to overrun those yellow lights. Something happens to some drivers and then they want to dart themselves into the road. So because they were going straight ahead, that's where they mostly was in the middle of the intersection where something like this happens. The second problem is turning to the left. So, according to the information available, it's difficult to discern whether the location was signalized and what kind of traffic control was at that intersection available, if any, at the time that the accident happened. But because of you, according to the MPOs, you need to do the analysis for non-motorized, for the performance evaluations. I did put together a table, and then we have, when we take pedestrian accidents plus bicyclists, this is the results. For pedestrians, the collisions resulting in fatal injuries is on the increase. It's on the increase also collision resulting in all injuries. There is a decrease on fatalities for bicyclists. But when we take away all numbers for bicyclists and pedestrians, we ended up by having almost the same rates of accidents, about 39% to 40% for the two modes of transport. So bicyclists are, even though they have a separate network, still they are not that safe as we are led to believe. So key observations on these are the following. There is an increase in the number of registered vehicles, on the collisions per 1,000 people, on the number of reported collisions per 1,000 people, on the number of collisions involving pedestrians in all injuries, and the age group 20 to 24 happens to be the one showing the largest number of fatalities. That's one level of key observation. And then we have bicycle fatalities, for instance, show a steady decline on the 5 years period. But when we take the injuries, that is on the increase. And motor vehicles continue on that number of 13% injuries per year. So far, that's the table. So in case you find any questions, you have the data there. In case you want to either dispute that or make any comments, at least you have the information. Now we move ahead to the transportation equity analysis. It's a very important component. Now we discuss whatever the actions of the pedestrians, the movements maneuvered by the driver. All the things are fine and dandy. But then now we need to go closer to discuss the transportation equity component. So in this case, transportation equity can be defined as a situation where a particular mode of travel is safe, is secure, and improves mobility and accessibility in a very fairly manner, thus enabling all people to participate in the socio-economic life of their communities. That's basically, it's like you remember the ladders of opportunity. That's what transportation should take us to jobs, to health, to education, and so forth. I'm using equity because it's a more expansive approach to transport that goes beyond just the 5 E's. In this case, enforcement, education, encouragement, evaluation. Now we want to include equity. And equity, we want to do it in 3 forms. Socially, that means the groups that we want to protect, to serve. We want to do it spatially. We want to find the location where this situation is happening. If we want to do it by procedure, what kind of policies we want to implement in order to make sure that this equity approach is actually sound. The reason behind this is that we have a number of populations, but then we have caregivers, we have the newcomers, we have the low-income households and so forth. But we have other populations that quite seldom we include, and are those ones that are too old or too young to drive. They are populations. Some of these may lack a driver license. They are a population. For many, motorized transportation costs are out of the reach of their household budgets. Or many are without access to, have decided not to own or operate a vehicle, but still we need to serve them. Others have postponed or retired or eliminated the need to operate a motor vehicle. Therefore, they become pedestrians. And finally, those ones that for any reason may have a medical or a physical condition that prevents them from actually being active in the transportation sector. So these are the objectives of what we want to do today. And just want to, how long? Do I still have time? You have 20 minutes. Okay. On this transportation equity component, I want to pay more attention to the roadway characteristics at the collision location and to the geographic distribution. So we want to focus our attention on the location and the scale of the problem. There are some elements that we need to consider when we want to understand which ones are the determining factors of the pedestrian safety. How can we help? How can we improve pedestrian safety? So I have done a review, a literature review, and then the literature review reveals that pedestrian safety is compromised by conflicts between vehicle and vehicle, between the vehicle and the pedestrian, and between the vehicle and a bicyclist. So those are conflicts. These conflicts interfere with access. They also present obstacles to connectivity and impediments to safe, comfortable, and direct access to activity centers in the community. So I have these 4 elements. These are taken from the literature review, but I just want you to please focus your attention, number one. Pedestrian fatalities are distributed unevenly through space and time. That means that whatever we find out today, they may be different a year later, and the location may be a different one. So it's not for us just to be focused only on finding hot spots. There are other areas where our attention is needed. Also, pedestrian fatalities are more likely in areas where there are higher levels of pedestrian activity, around the hospitals, around the schools, around activity centers. And there is a significantly higher number of more injured pedestrians, cyclists, and motor vehicle occupants at the intersections in the poorest neighborhoods. So that's where the problem is. So being poor is a big problem. And one issue that happens is children, they actually, in poor neighborhoods, are more exposed to dealing with traffic through their neighborhoods. So these are part of the things that I'm doing. There is something happens. I need to basically use this slide. In our presentation, what I have done is focus my attention on these areas. I just jumped one slide. On the location of the streets, the segment from where to where, on the signal type, whether there is a signal type at the location of the accident, on the traffic volumes of the accident, and the last one, functional classification and the number of traffic lanes. So these are the findings. Let's see what the findings are telling us. About 44%, 44.9% of these locations are located in the city center of the city. So neighborhoods that are central neighborhoods, based on the location of the intersection. The signal type tells us that a large number of these accidents happens at intersections where there was a signal for vehicles, not for pedestrians. Then, most accident happens in high volumes arterials, 10,000 to 40,000 arterials. So very difficult for people to navigate. That's where the classification comes. And then the number of traffic lanes, even though we have arterials with 4 lanes and so forth, divided and undivided, most happens to be on 2 lanes and divided. So what this means is that they were really central roadways, and in many cases they were one-ways. Like you have here in the city, why so many highways, number 7, number 9, like that. That's basically what happened. So, this is a little map, but the point here is that we are talking about 1,814 collisions. So, if you look at the number of collisions, wherever there is only one collision, took place at 503 intersections. You get that? And then we just come down. So then those numbers, like the green ones or the red ones, like this green or the red one over there, are these ones over here. Accidents in one single intersection. You get that understanding of that table? So basically it's telling us that the number of, basically the locations is it's coming down, the number of collisions is increasing. Therefore, those are the most dangerous areas of the neighborhood. They are scattered evenly around the entire city. You can see them on this particular map. So, then we have them by this community characterization area. Those are areas that come from the census, Canadian census. It's like what you have here is transportation analysis zones. That's something similar. So, and this happens to be in downtown, mainly. But in this downtown, this is what we have. We have issues with upgrade facilities. It's very difficult for winter for people to go really walking across here. But the point here, this is what we see. But I want you to see behind, on the two sides of these things, we have the rail marshalling yards. Because they are so long, 2-3 miles in length, or 4, then we have a number of T intersections. And if you know, even though they are very common, some turning movements at the T intersections are a little bit more dangerous than a 4 intersection. So you don't see that, but it's behind that, the marshalling yards, this is what we see. So people, pedestrians, they need to walk. If you want to cross, let's see, from this bridge to this one, behind the marshalling yard, it will take you at least 3 miles. So basically becomes your activity as pedestrians is more expensive, the use of your energy. I'm just on my way. So now we see, again, these are the neighborhoods in the city, the two ones in the city end, city downtown, north end. So that's for us to find out where the accidents are happening. We can see in some neighborhoods that are rather few or none at all. Okay? So we have a neighborhood called Point Douglas, North Point Douglas South. The presence of arbitrary barriers that interrupt continuity and directness for pedestrians discourages long-distance pedestrian trips and community journeys around the neighborhood. So now it's for you to see what's happening. And here we have this table too. These are the injuries. And as you can see now, we have the number of accidents and the number of pedestrians. All of these, the majority of them, with the exception of two of those two intersections, are all downtown. So both injuries and fatalities are concentrated in intersections in downtown neighborhoods. So now we have the school division. The school division is another kind of a scale, which is very important for many reasons. That's where we have the largest number of schools, 79 schools. That's where we have the largest number of students, 29,000. That's where we have the number of facilities. So the university has a campus, Red River College has 3 campuses, University of Winnipeg is right there, plus a bunch of labs. So we have 61% of all major and minor injuries are concentrated in the school division number 1. So this is what I just want to, and then the final one is, I discussed this with somebody today, is I just want you to look at this. These are the neighborhoods that we are discussing, the name of the neighborhoods that are represented on the maps. So this is the walking chair in the city of Winnipeg. But now this is the walking chair in this neighborhood. Get it? So when one neighborhood is 4.9, these guys are 20, 40%. So a lot of people on the streets. That's one. But the second point on this table is, this is the city income level. That means, see, but over here, okay, these are city income levels and people that are receiving any kind of subsidies. In Canada, we don't have food stamps or stamps or any of those, but there are way so many little things like child support, So these are the numbers in these neighborhoods that are depending or receiving. So the problem here is that we tend to say, oh, it's wherever there are some particular kind of communities. I'm trying to bring to your attention, the color of the skin of the fellow has nothing to do with this. He said the condition, the social condition. So when somebody says, oh, blacks are prone to be killed by cars. No, low-income blacks, which is different because Mrs. Ofra, she flies. See, you get the point? So this is what happens. So I have some findings, and we discussed those findings already, but the one that I just want to bring to you is that a number of reported fatalities happens at a vehicle intersection location where pedestrian crossing facilities were neither available nor in proximity. So people were actually on their own. Because this is important because there are neighborhoods. I have in one of the reports a map locating all the signals for pedestrians. And there are neighborhoods where there is an abundance of pedestrian crossings, but there are neighbors where there is a thirst for them. They are not really available. And the second is that there is a number of, there is a number of intersections here that collisions basically happens in the past, but then becomes recurrent. So we may call them hotspots. Let me guide you over the recommendations. The number 2 is the most important for me because it's the need to suggest conducting walkability assessments. Then, based on the reports, to identify unsafe drivers' movements and pedestrian actions that are really all overlooked when people are reporting. And the third one, point number 4, to improve the quality of data collection and to assess the impact and curtail the practice of filing incomplete traffic reports. Curtail that practice. Otherwise, I told you, we are in the neighborhoods of 40-something% of unknown actions or unknown maneuvers or unknown locations. This is very problematic for us. And basically, the last one is to prepare active transportation, neighborhood revitalization, school traffic studies, all of those ones to improve pedestrian safety. One problem that happens is many neighborhoods, they use some kind of consultants to do their neighborhood plans. And for some reasons, even through public involvement, people said, oh, we find this too dangerous to cross the streets, rah, rah, rah. I review all those plans. No one mentioned accidents, traffic accidents of pedestrians. They probably report what the community said, but they don't go farther to investigate which ones are the locations and the conditions of those. So this is what it is. In conclusion, unfortunately, regrettably, this number of fatalities continues on the increase. Pedestrian safety is compromised. And pedestrian safety being compromised means that people tend to do less. So that's where we are. We need to evaluate the built environment features as pedestrians and neighborhood socio-demographic characteristics are vital. Those are vital components of a transportation equity approach. So, and to consider, based on the information, the analysis basically of pedestrian safety countermeasures that not only meet established regulations, but also benefit the community. So with this in mind, just want to leave you with this. and I really appreciate your listening to me. Thank you. Thank you.